Okay, appreciate the media being here. We'll start the conversation, and there'll be several points that I will make, and then our guests will make. I'll talk about the new mandates or the executive order regarding the big boxes that's forthcoming. Director Barber is going to talk about scams that are occurring out there, trying to separate people from what could be their money having to do with response to the coronavirus federal mandates. And then Director Barber is also going to talk about the testing that's underway for our city employees. And I would like to point out also that if you look at the national average of the number of people that have been tested and those that have been proven and what the increase is, if the national average increased 20% yesterday and the state increased 15%, City of Mobile was about 12%. Not sure how you want to interpret that, but I would much prefer to be behind than at the lead of that conversation. So, I'll say it again, our first and foremost concern is your health and your safety. Everything that we're doing is trying to make sure that you're protected, but you're the person that's most responsible for your own health, so we encourage you to stay at home and follow the other CDC guidelines having to do with washing your hands, with social distancing, not touching your face. In Director Barber's comments, he will talk about the first city employee that we have identified as having being COVID positive. Also, let's see. So let me speak now about the mandate for the big boxes. Subject to the City Council's attorney's approval, later today we will put the executive order out, and specifically what it says is that we will use the fire rescue or the fire number of what is the percent capacity in every building. We'll use that, so if you have a building and the fire capacity says that you have 500 people in that building, we're going to say that you can only have 40% of what the rating is for your building. This is really directed at our big boxes, and that would be Home Depot and Lowe's. So it would go in effect at 7 a.m. on Thursday, April 2nd. That gives the big boxes tomorrow to determine what is their capacity and then to determine how they will be able to monitor and control the number of people being in their store. It's very simple. If you have the ability to have 500 people in your store, and we say you go into a 40% capacity, so you'll take the 40% of what your number is, and you will only allow that many people in the store, and only when people leave will you let others in, and it will be up to the store to monitor that. But we will do checking, and as we come in and we check, and if we look around and the store is overcrowded and we count the number of people in there, then if it looks like we have made a mistake in saying 40% capacity, we may drop that number down to 30%. Those numbers were not just completely pulled out of there. I talked to the Rouses that run Rouse's grocery stores, the Greers that run Greer's store. So there's been some feedback trying to make sure that we're getting that right. The whole purpose of this is to make sure that we have the proper social distancing inside the store. So those who are shopping and have the ability to go in the grocery store or to these big boxes, please cooperate with what we're asking you to do. I mean, it's your responsibility to do that, because if you don't, then it's going to require us to do more than what we would actually like to do in that regard. A couple other things that the store will be required to do. At the checkouts, we want to make sure that they have marked on the floor like 6-foot spacing. We want to make sure that when you check out from their employee, the cashier, that you use the maximum distance. Some of those are pretty close spaces, but we're hoping that you can get the 6 feet in between. We're also going to ask that you follow the CDC guidelines on cleaning and sanitation, and that the grocery stores discontinue any self-serving foods or product sampling. All this will be laid out in the executive order. Then one other item is that we're asking, and really the stores are already doing this, but we want to make sure that the most vulnerable of our population have the ability to go in and shop without the masses coming in. So that's up again to the store to determine when that's going to be. And we would also ask that you encourage pickup and delivery options for your customers. So you'll be able to see that executive order once it's been approved by the City Council Attorney, which will be coming from out of George Talbot's office later today. At this time, I'd ask Director Barber to come forward and make some remarks about the scams that are underway. And this has to do with recent information from the FBI, and also to talk about the testing that we're doing for all of our first responders and the results that we're seeing. So, Director Barber.
All right. Thank you, Mayor. As the Mayor pointed out, I did want to talk, at least warn the public about these arising schemes or scams of fraud that we're seeing in our country. Talking to Jim Jewell, the Special Agent in charge of the FBI, this is happening even though we haven't had a report of it in our area yet. But one of them has to do with stimulus scams. This is a direct result of the stimulus package coming out of Washington, D.C., and the approval of that package. And what we're having happen is people are receiving emails or phone calls needing their banking information and routing numbers so that they can receive these stimulus packages or stimulus checks. That is inappropriate. The government will never call you and ask for your banking information. The way I understand that's to go down is the way you filed your taxes or paid your taxes last year will be the way that stimulus is rolled out. And so beware of anybody or any scam that wants your banking information, and that is out there now. Unfortunately, there's a lot of criminals that take advantage of a crisis like this and prey on the most vulnerable. The other one has to do with medical and vaccine scams, or a proposal that they're going to give you a self-testing kit for COVID-19 virus. These are out there too. We suggest any kind of medical treatment or regimen that you're on or want to be on, do not self-medicate, don't self-diagnose, go to a medical professional and have that done. But those are two of the more prevalent scams that are emerging in our country right now to victimize people that are vulnerable at this point. The mayor mentioned to you that we are testing first responders, and to my knowledge, we're the first ones to really do asymptomatic testing, which means that none of these first responders are presenting with any type of illness. But we began that because Synergy Laboratories here in Mobile donated about 500 of the COVID-19 antibody kits, which is a rapid test of the blood. It takes about 10 minutes in order for us to determine if the antibodies exist inside of a healthy patient, or any patient for that matter. We began that process yesterday with 131 of the first responders, and that's fire, police, and EMS. We did find 4 of them tested positive yesterday for the antibodies. They proceeded from then to the PCR, which is the nasal swab test, which will confirm whether the virus is active within the firefighter or the police officer. They have been quarantined at home until we get that PCR test back and further guidance from medical professionals. That testing continues today. I don't have the results from today, but if you look at what happened yesterday, that's about a 3.2% of that population that we tested that did have these antibodies. We're seeing roughly about the same, or roughly between that and 5% today. We will continue that testing until we have a sufficient sample size, but I do think it'll give us a better idea of what may be out there that's not showing any symptoms and has carried the virus or has already had the virus. Up until now, we have only been testing symptomatic patients that are presenting with shortness of breath, fever, or difficulty breathing. And so with that, we'll take questions in a minute, I think.
Thank you, Director. At this time, Council Vice President C.J. Small will make a couple of remarks.
Thank you, Mr. Mayor. I just wanted to provide a quick update on Mobile City Council focus right now. The council is continuing our weekly meetings, although based on the guidelines handed down by the Alabama Department of Public Health, only a number of people are being allowed entry. And in-person presentations, petitions, and other communications to the council have been suspended for 30 days. During this time, Citizens are wanting to make a public comment can email the city clerk at cityclerk@cityofmobile.org up to 30 minutes prior to the meetings. They will be acknowledged and received during the meeting, distributed to the council members, and included in the meeting minutes. Citizens can also watch the live stream of our meetings, which you can find on the Mobile City Council Facebook page. We are focusing our efforts on ways to address the impact this virus is having on our communities, especially the most vulnerable among us. We are continuously sharing information and resources for the community on our Facebook pages and throughout our newsletters. If you do not already receive these, please connect with us. Also, if you are in need of food or is struggling with the impact of this pandemic, call 211. They are an amazing community resource, and they are here to help you. There is no doubt that we are facing one of the biggest challenges we ever have faced in this community, in our community. But if we work together, we will get through this, and we will be stronger than we have ever been. Thank you, Mr.
Well done, Councilor Small. At this time, Dr. John Stone, the Vice President of Medical Information at the Providence Hospital, will make a few remarks. Dr. Stone?
Thank you, Mr. Mayor. This is really just a catch-up to assure everybody that the hospitals are working very hard to be ready for what is yet to be an onslaught of problems. In talking to one of the physicians that practices at Providence today, he wanted me to remind everybody that before you go to one of these testing places or go to their office, that you should call their office and get advice on which location you should go to or whether you should go at all. And a lot of people are doing the screening within their offices, but they tend to do it outside in tents as we are doing at Providence. In terms of the hospital itself, we do have some inpatients that have been positive. It's not a lot. Our intensive care unit ability is still quite good. Our ventilators that we have are our usual amount that are being used right now, so we have quite a few available for later, and I think that's probably true of all the hospitals. But we're still trying to brace for what is coming yet, and today we were told by the Alabama Hospital Association that probably the last week of April will be the most kind of the peak of the whole event. So there's a lot yet to come. We have not quite seen it yet, and I've been characterizing some of this as a bit of the lull before the storm. So we're waiting for that to happen, but I think we're ready. We're accumulating protective gear for everybody as much as we can get. It's still a problem. The testing, I like what we heard just before, but we also know that there are still issues with the number of tests that can be done, and I would emphasize that screening is not testing. When you go to get screened, you then can be approved for testing, but the idea of screening everybody is because you can't test everybody because you don't have enough test material to just do it on everybody that comes in with some complaint that's maybe not very suspicious. So the testing itself is done at a lab location, and that can be anywhere. We've sent things to Montgomery, to the state lab. Ascension Sacred Heart in Pensacola has been able to do several tests for the city of Mobile and the hospitals in Mobile, but they too are running short on their kits to use for the testing. So that's kind of on hold right now. But they have several for the time being, and they hope to get more, in which case they might be able to resume running some tests for people over here, for the hospitals over here. But that's the sort of issue that's, I'm sure, nationwide, and we are not spared from that. So we have to be very particular about who we test at this point. But that's really all I have. But thank you very much.
Thank you, Dr. Stone. I would just reiterate what he said, that screening is not testing. Okay? You're going to be screened to determine if it's necessary for you to have a test. And you'll know if you've had the test because you'll have had the nasal swab sample taken, and then they will actually test. And the results of that are not known until it gets back from the laboratory. And then you'll know whether you test positive or not. At this time, I would call on Dr. Laura Cepeda, the Medical Director of the Mobile County Health Department, to make a few remarks.
Thank you, Mayor Stimpson. I just wanted to let everybody know, as of now, the positive numbers for the state stand at 979 confirmed positive COVID-19 patients. For Mobile, that number is 52 at the moment. Right now for the state, there are 20 deaths that have been attributed to COVID-19, 13 confirmed deaths. And just to help explain the discrepancy there, for every death that's reported, the Department of Public Health has to go and investigate that and go through that case and make sure that it is completely attributable to COVID-19 and not just an incidental finding that someone had something else that caused their death and not just they also had coexisting COVID-19. So if you're following that, that's why you'll see that discrepancy. So most likely that those numbers will catch up to each other and probably match or come close to matching as time goes on. But we just want to make sure we get that right and we don't over-attribute any deaths to COVID-19. As of today, the Mobile County Health Department is currently investigating clusters of respiratory illness at one long-term care facility in Mobile County and one correctional facility in Mobile County, and we will keep you posted on that as that develops. Also, we have begun receiving many calls on the COVID-19 information line from employees who are very concerned about potential exposures in their workplace. To hopefully reassure you, there is a very well-developed process whenever anyone tests positive for this. Everyone who is a potential exposure to that person is mapped out, whether it's in their home, in their workplace, anywhere that they spend any significant amount of time, and it's within 6 feet and greater than 15 minutes of exposure is considered at risk from that patient. And so every one of those people is notified, even if it's a workout class or something like that, that you have been potentially exposed. The Mobile County Health Department will track those people down and notify them individually. So if you have been truly exposed at work, we're going to let you know. So please do not worry. If you haven't heard from us, then you are not truly exposed at this point. So as of this point, we want to continue to encourage the hand washing and do your social distancing. If you're feeling a little unwell, stay home, isolate, call your doctor's office and get some advice from them. Most places are doing telemedicine, even if they never have before, and they're very willing to advise you over the phone for the most part. If they have testing available and they think that it's warranted, they will generally offer that. If not, they may be able to direct you to somewhere that has that. But please, if you're feeling ill, stay home, isolate at home, and call your provider and get their advice on what to do. And lastly, this is a time where a lot of people are feeling isolated, so try to reach out to people in every way that you can that doesn't involve breaking that social distancing. call, email, and text your family, your friends, your neighbors to check on them. And check our MCHD Behavioral Health page on Facebook for tips and tools for dealing with this as well, because it's really hard. And it's not the way we're used to functioning, especially when we're concerned about people. So we can get through this together, but now's the time to really hold on and don't give up on that social distancing. Thank you so much, Mayor.
Thank you, Doctor. Just to repeat one of the things that she said, if you think that you're sick, you're showing symptoms of being ill, fever, chills, aches, pains, call your physician in order to set up an appointment to go be tested. That's the first step, is call your physician in order to get the appointment. Another thing is there's a certain amount of social responsibility that should be going on, and I'll give you an example. If I found out that I was tested positive, and if I've been working with Director Barber every single day, it's probably up to Director Barber to sequester himself or quarantine himself, because he knows he's been exposed to me. I've tested positive. So if Director Barber knows that, that's what should happen. That should happen all throughout our community. That's how we're going to keep from spreading this. Other than staying at home, which everybody should do if you can, but if you know that you have been exposed, you need to self-quarantine, and that really is a responsibility that we can't track all the contacts that have been made, so please help us in doing that. So at this time, I'll ask Meg Fowler, the director of the History Museum, to make a few remarks. Meg?
Thank you, Mayor. I want to tell you about 2 initiatives launched in response to COVID-19. The History Museum of Mobile has been able to quickly deploy a History at Home program, and these are exhibit tours and activities that are for both adults and children. There's content that's growing week by week, but right now, for example, you can see a guided tour of our ancient Rome exhibit that the whole family will enjoy, as well as 3 activities in this example that use things that you have at home that teach you crafts, that teach you a little bit about that ancient Roman history. We also have a guided tour of Fort Condé, and accompanying that, colonial activities, games, worksheets. These are really wonderful resources for families who are home with their children. Next week, we'll be looking at World War II in Mobile. There'll be a recipe for making rationing cakes. After that, we'll look at baseball, at sporting history in Mobile. And all of these, again, are packaged as lessons that make them very easy to use at home with your family. Those are linked from our Facebook page or also on our website, historymuseumofmobile.com. The second thing is a program called Your Story is History. Sometimes we think of history as something that happens to other people or that's something that has happened a long time ago, but we right now are living through a very serious historical moment. And recently I've been looking at some letters written by a Mobile man in the 19th century about an outbreak of yellow fever in Mobile in the 19th century. These are the sort of sources that historians look back to, letters, journals, to reconstruct the past. And so at the History Museum, we want to make sure that we're preserving those sources, helping create those records for the future. And so we're inviting citizens to perhaps keep a journal, somehow log those experiences, whatever that might mean to you, to submit those records, and then we will then preserve them for future generations. For some people, this is a very difficult and painful time. For other people, this is a much more mundane experience, but all of those experiences are important. They're all a vital part of the historical record. And so whatever that is, whether that's keeping a journal, whether it's emails, blog posts, whatever those records are, we'd be grateful for those to be able to preserve that, because those are the records that historians will look back to 100, 200 years from now. Details on that, guidelines for that, are also available at historymuseumofmobile.com. And the last thing I'll say is this. History tells us that we are not the first Mobilians to confront epic disease. There are many that have walked this path before us, but we are also the best equipped in history to deal with it. Our medical technologies couldn't have been imagined 100 years ago. And so now, particularly more than ever in an epidemic, we are so grateful to be living in the 21st century. Thank you.
Thank you, Meg, especially for those words of encouragement. We have overcome things like this in the past, and we will overcome this. I would say that under Ms. Fowler's leadership, the History Museum has made great strides, and this is a perfect example of someone realizing there's a void out there in the families of what do you do with your child, or what do you do to engage your mind other than worrying about and being fearful of the coronavirus. So they were proactive. They came up with these programs, and for that, Meg, thank you so much. Appreciate it. So at this time, we'll be glad to answer any questions that may happen. But I'm going to go her first.
No, you're fine. Can you discuss the hazard pay? I know the Sheriff's Office announced that they will provide the hazard pay for their employees, but can you explain that?
So the question is, would we explain the hazard pay for employees? And I'll let Director Barber answer that, having to do with hazard pay for employees, or how are we addressing additional pay for employees during this crisis?
If there is any.
You know, and I hadn't looked at the county's way of how they handle that type of situation or what their hazard pay consists of, but ours, we're pretty much running as normal. We're running all our operations that we can, and so all our services, be it our trash and garbage pickup, public safety, and EMS, are running on normal schedules.
Chief, don't go anywhere. I got a question. Of those 4 employees that you said tested positive for the antibody, I know you can't name them. That's fine. Can you tell us, were they police officers, were they fire, were they EMS?
You know, yesterday,
Repeat the question.
yeah. All right, so the question is, of the 4 employees, the city workers that are first responders that tested positive for the antibodies yesterday, 3 of those were Mobile firefighters. 1 of them was a Mobile police officer. We do know that we have more first responders that tested positive for the antibody today. I just don't have those numbers in yet, but we'll certainly update you as we get them.
Were they symptomatic? Those ones tested yesterday?
These are asymptomatic.
So the ones yesterday were asymptomatic?
Asymptomatic. I believe one of the firefighters showed very mild symptoms, but these are asymptomatic for the most part.
And one more time, just in case people on our Facebook Live missed it, but can you kind of go through the steps that you all are taking to make sure that our first responders are safe during this time, make sure that they have the equipment to handle this? I don't know if you would.
Well, you know, so the steps taken to protect our first responders, certainly they are critical infrastructure personnel, so that is part of why you do see us taking steps to protect them, but making sure they have the basic personal protective equipment, which is the N95 mask, gloves, and that they're able to shield themselves as far as either a face shield or goggles. Those that are in close contact with known patients of COVID-19, such as our EMS department, also wear some type of protective clothing or suit over that. We also, like in this case with the firefighters, what's unique about firefighters, they're confined at a station together, and so for 24 hours at a time. So we had to take additional steps working with the city to deep clean those stations where we have at least the idea that they have antibody positives in that station, and monitor the rest of those companies.
You guys are screening the first responders with the blood tests first, but the state health department issued a warning today that negative results don't necessarily mean you are not infected. Is the city working on a plan to test all first responders with a swab?
Yeah, you got. This is they are correct in the sense. In order for you to have antibodies, you have to have had the virus for some period of time, in excess of 5 days, is my understanding. And so it could be at the early onset that you would test negative. The same can also be true sometimes for the PCR test as well. And so to continuously monitor for symptoms and then follow-up tests. But they are seeing medical professionals at these sites. We're specifically testing at the diagnostic medical sites, either at 1700 Spring Hill Avenue or on Hillcrest Road. So we are screening with medical professionals. They are asymptomatic, and so it causes us some issue. But we are being able to identify the ones that have the antibodies already in them, which means that either they currently have or have had the COVID-19.
Did any of those firefighters or that police officer have come in contact recently with anyone in the public? Have you guys notified people? Have you guys done that process yet?
We do, and
Any health departments down?
well, the question is, of the 4, do we have any known exposures in the public? The answer to that question is no. We do have a way of reporting infectious disease contact with first responders and patients, but in this particular case, it's impossible for us to know where it may have originated from, because again, we're talking about patients that are now asymptomatic, that are not displaying any kind of symptoms, and so it's hard for us to be able to say where they came in contact. I can tell you that I was a little bit relieved that only 3.2% of the tested 131 yesterday, because these first responders are in constant, very close contact with the public. And so they're handling patients, they're arresting people, and that happens every day. And so I was glad to see that they were building antibodies against this, and we certainly still continue to provide the protective equipment.
Any other city employees besides first responders have tested positive for it, to your guys' knowledge?
Well, right now we're just, in this particular test site that we're talking about, we're only running first responders, and again, that's police, fire, and EMS.
Not just testing, but I don't know any other, if you guys have been made aware of any city employees, be it trash collectors or people who work at City Hall or anything.
Okay, so the question is, have we confirmed COVID-19 in any city employee? And the answer to that is no. Is there a plan to swab all first responders? No, it's not necessary. They're asymptomatic, but we are taking the nasal swabs or the PCR test from anybody that has the positive antibody within them, that they have been exposed to COVID-19. And that is mainly to see if he's developed an immunization to it, or if they're still actively shedding that virus and are still contagious. So until we get that test back, and that's the confirmation test we're looking for on the nasal swab, that particular employee or that first responder is asked to quarantine themselves until we can confirm whether it's an active virus or not.
I have a question for Mayor Stimpson. Can I get a clarification on your executive order you guys have been putting out? You were talking about big box stores, and you specifically mentioned Home Depot and Lowe's. Yesterday you said this was going to also include grocery stores. Is that
Yes,
also
it will. Yes, it covers Rouse's, Greer's. It'll cover the grocery stores also. And as soon as we get clearance, you'll get a copy of it. The media will get a copy of it, and it'll delineate all of that.
Do you think this is going to be a good measure to try to hopefully keep people spread apart in those stores?
Yes.
And a lot of times, especially on the weekend, there was a lot of folks when I was shopping trying to
Yes.
pack in there.
Yeah, we have followed the outlines of some other states that did this before us, and so we are hopeful that it will address the need. But I was very pointed in saying, if we go in and visually and have the same experience that obviously that you had, where you seemed like it was too crowded, then we'll change our number from the 40% number downward to 25 or something.
Does this also affect other businesses that are remaining open? I'm not going to mention the name. There was a restaurant I ate at today that drive-through service coming in very close contact with a lot of people.
So the question is, does this apply to any other businesses other than the big boxes in the grocery stores? And the answer, the executive order does not. But already what the governor, her executive order or her mandate was that, the gathering of more than 10 people wasn't supposed to be bigger than that. So that should already be covered for all those takeout places. Yep.
Clarification on the executive order and how it is processed through the government at this point. I know you guys passed the local public health emergency, so that gives you the authority to
Yes.
make this executive order, and you're only having the council attorney check it.
Just to communicate with the city council, just to make sure that we're in sync on this, and that's why we're waiting on that collaboration from them. Yep.
And it goes into effect April 2nd if it's all approved, correct?
That'd be, yes, sir. The question is, when would the executive order go into effect for the big boxes and the grocery stores? And that would be at 7 a.m. Thursday morning. So are there any questions for Dr. Stone?
Yeah, the health.
The health department, okay? Dr. Cepeda. Yeah.
So you guys said that you guys are investigating clusters at both the correctional facility but also assisted living facilities. Or an assisted living facility. Are you able to identify that facility?
So the question was that, yes, we're investigating a cluster of respiratory symptoms at correctional facility and long-term care facility, and could I identify that? And no, I cannot.
I know in Florida, they are identifying some of those places that people would be able to be made aware, maybe to avoid those. You guys are not able to.
No, we're not.
Is
Not
that
at this
for
point.
HIPAA purposes, or-
Well, with just, one, and this is just such the early stages of that. I mean, this is actively going on today. So, no, not at this point. One patient from each has tested positive for COVID.
So that's all it takes to call it a cluster.
I have one more question for you, Mayor Stimpson. I'm sorry. There's been a lot of talk about testing here, trying to ramp up testing, but in other places, in other countries, places like Korea, they were doing a lot of disinfecting as long with testing, like making sure spraying sidewalks and doing things like that. Viewers have been calling us asking why there is not more of that going on, the disinfecting aspect of it. Are you guys have any plans for that?
To our knowledge right now, there's no evidence that's showing that disinfecting is really effective out in the streets. And so we're aware of it. We're monitoring things like that, things that we hear about. But at this point in time, we don't have any broad-scale plan to disinfect sidewalks and streets. The first priority is to get the social distancing done and knowing that will have an impact. Okay? So in conclusion, I'll say this, that please stay at home, but also think of Category 5 hurricane. The feeder bands are hitting us, and if the feeder bands are hitting you, what do? You stay at home. I don't know how long they're going to be there, but it's hovering off the coast. You've all seen it. You've known how to react, and that's what we're asking you to do. So appreciate your participation today, appreciate your cooperation, and we will push through this, and thanks for that. Have a good evening.